Welcome to Medical Mondays, a 12-part limited series that we're going to be airing once a month that is going to cover the most common topics that are medically related that you encounter while you're cruising. As a physician, this is something that I've been wanting to do ever since we bought the boat because I just don't feel like there's enough medical training and information out there for sailors, for full-time cruisers, for people who just get on a boat for a weekend. So let's jump right in. Our very first episode in this brand new year is going to cover what I think is the most important topic, which is building the ultimate medical kit yourself. Now, what is a medical kit? Well, a medical kit is a bunch of supplies and equipment that you feel you're going to need either in an emergent situation, on a regular situation, that is medically necessary, that you keep on the boat on a regular basis. Now, how is a marine medical kit different than a land-based one or one that's on a plane? In short, it isn't, not in theory. Basically, a medical kit is supposed to meet the needs for you and your family or your crew in an immediate and urgent manner, and also meet the needs of your environment. So in the middle of Kansas, you might have some environments that you will never see off the coast of Japan, and there are things off the coast of Japan that you will never see in a plane, or in our case, in the boat. And our environment happens to be the ocean. All right. And so now the big question is, where can you buy the perfect medical kit? What makes the ultimate medical kit? And the truth of the matter is, that doesn't exist. Put that credit card down. Well, you might have to pick it up for other things, but stop buying pre-made medical kits. And I say that with the utmost respect to those medical kits. Some are absolutely positively inclusive of everything that can go wrong. They have IV bags, they have antibiotics, they have suture kits, they've got everything that you could possibly need. But the truth of the matter is, they weren't made for you. They weren't made for you and your crew and you and your family, you and your boat, and they weren't made for the size of your specific boat. And the truth of the matter is, the ultimate medical kit is the one that you make for yourself. You might be now saying, no, I have no medical experience and I have enough boat projects on my head. I cannot sit down and put together a medical kit from scratch. I don't know what I need. I'm afraid of missing something. I'm out in the ocean and it's an emergency and I'm the one who packed our medical kit, and that's just not okay. Well, that's the entire point of this episode, and I hope that by the end of this, you feel comfortable starting from scratch, building your medical kit, and knowing what the minimum basic things you need in there and the things that you're going to add to make that your own kit. And I think anybody who's been a cruiser or a sailor for more than an hour, or maybe two, knows that the best person for that repair job is most likely you. And that includes repairing yourself. And that includes having the quality control, the quantity control, the adaptability control of your med kit to make sure that it was going to meet your needs, your cruising needs, and the needs of your crew and your family. Let's get into the nitty-gritty of it all. So, step one. Stop. Put that credit card down. We're not at the buying stage yet. We are at the organization stage, so we're going to kind of work a little backwards. Think about how you want to organize your med kit. Think about where you want your med kit to be. How big can your med kit be depending on the size of your boat? For us, these are the boxes that we organize them with. These are our organizational levels, which we'll go through in detail later. And if you like the way we organize them, we do them sometimes by symptom and sometimes by system, like cuts and trauma or medications or tummy issues. And it may not work for you, but that's okay. You have to figure out your system that you can quickly access, that your crew knows exactly where every single thing in the med kit is in a very, very quick and efficient manner. And like I said, we'll go through how we organize it. And if you like the way we organize it, you can copy it and then you can adapt it to fit your style. Us sailors and cruisers, we do not know what the heck we're doing next month. We have a rough idea, though. We have a rough idea that I want to coast the east coast of the U.S. I want to cruise and cross the Atlantic Ocean in June. and that is going to look very different. So what we have in our medical kit is what our plans are for the next 6 months, which is cruising the Caribbean, some passages, 5-6 day passages at the most, but not an Atlantic crossing, and not being away from land and some sort of medical help for probably more than a few days to a week. So that's why our medical kit looks the way it does, and it's going to look completely different next year when we maybe do an Atlantic crossing. Documentation is very important when it comes to medical events. One of the things you're going to need to do is, if something happens, you're going to need to pick up that VHF and you need to tell the Coast Guard or whoever is listening a little bit of information on the passenger that's hurt and what happened and what's going on. So for those things, you need to keep on hand somewhere in your nav station, somewhere near the VHF, or somewhere where you can get to really, really quickly. 2 things. One is your, what we call a medical badge. You can call it whatever you'd like. But basically, you're going to have one for each crew member. It's going to have their basic information. And we've made one available to you for free. So if you want a starting point that you want, and then you can make your own, you are welcome to use it. The link is in the description. But ours has the person's name, age, sex, their blood type, allergies, their emergency information, contact information, their home port, and any special wishes. And that's very important for the crew member to fill out and for it to be available and ideally laminated so that it doesn't get wet. The second piece of documentation you need to have is a medical emergency documentation form. We've made this form and made it available to you for free, and make sure that you have it on some sort of a clipboard so you can take notes, and that you have a very, very serious pen, because it's a very serious event happening. It's very scary and very stressful, so make sure that you have a serious pen to keep you company, and this pen is going to help us go through the rest of this form. But basically, you want to have some basic information about the vessel and the captain, including the MSSI number, today's date, where you are at the time, and the patient's name. The rest of it basically documents the incident, when it started, how long it's been going on, what have you done, what has the crew done to help with the situation, and the last vital signs that you took of the patient, which includes their pulse, respiratory rate, temperature, blood pressure, and any other special vitals that you took, like blood sugar or urine volume, whatever it is that you might have taken that was extra, you can put it in special, the current status of the patient, and then what kind of need do you need? Do you need to be helicoptered out? Do you need just help at the dock when you get in and an ambulance waiting for you there? All of these information is going to disappear very quickly from your brain as soon as this happens. So it is good to have something like this handy and just give somebody that job. If you don't have enough crew to give that job, as soon as you can think straight and you want to call the Coast Guard, take 30 seconds, take 1 full minute, take 2 minutes at the most, fill this out, and then call the Coast Guard, because that's going to give them a lot more information about what just happened than if you just call in and say, ah! I mean, screaming helps. Screaming does help, but I think more information helps a lot more. We lost the light yesterday, so we continue today on a much, much sunnier, nicer day, but it is way windier, so I do apologize for the extra sound. Let's go through our med kit and what we think we're going to need for the next 6 months with our cruising plans, which is mostly the Caribbean. Now, if you want a detailed list of every single thing in our med kit, how many we have, where did we get them, how much did they cost, everything, please be sure to click on the link in the description for the med kit inventory, and that's going to give you a way more detailed list than what we're going to go over today. But I think it's nice to see what's in our kits and why we have some things the way we do. So this is our small kits and trauma. So we have things like that are very simple, like skin tape and bandages and alcohol pads for your small cuts. And then we've got ones like bleed stop, which is great little clotting powder for a larger cut where you might need some help with clotting. And something like the SWAT, which is just a very bad day. It's a very large tourniquet, which will save from you, save you from bleeding out. But yeah, again, very bad day, but very good day if you save someone's life with it. Our small cuts one kind of overflows into the large cuts, which holds basically a lot of our large gauze and sponges, and also all of our splints and ace bandages, you know, for when you bump that knee or you just twist that ankle really hard. This is where everything lives. The other box, and this is one of my favorite boxes, is the basic tools box. So the basic tools box has stuff like a soft C collar, and it has a lot of items that I know how to use as a physician, and that's why I have them in my med kit. For example, a blood pressure cuff that's both adult and one for pediatrics. One that allows me to actually intubate a patient, which is basically getting an airway when somebody needs an airway. It's very, very advanced, but again, I have the comfort and training to do it, so I have it in my med kit. I also have my stethoscope, etc. We also dive, so we've got an oxygen regulator with the key, which basically allows us, along with a mask, which basically allows us to use our dive tanks as ways to give somebody oxygen if they need it. So again, I know how to use all of these things. I've taught Dave how to use all of these things, and so that's why we have it in our med kit. I do not have a suture kit, as you noticed in the trauma list, because I don't suture regularly. I know how to suture, but I don't practice it regularly, and I don't think that it's necessary. I have plenty of other things to close up a wound and stop the bleeding, and for me, that's the best case. You'll also notice that a lot of these have very simple labels. That's because Dave and I know what's in every single box. We know exactly how to get it really quickly. But if you have a large crew or you're just in need of a more detailed list, you can also make a little inventory list of each kit, make it into a little card and stuck it in the on the box, or tape it up here. So if you want to ask somebody getting on your boat, you know, go get me this, they can say, it's in the medication box and this is what it's here. Now, the medication box for us is a bit of a doozy. We have everything labeled with expiration dates. We've got blister packs kind of controlled so that you're not looking through a billion different things. And again, Dave and I know exactly what's in here. This is where all of our, you know, ibuprofen and Tylenol and aspirin and cough medicine and seasickness medicine, all of those things live with our medication box. Always remember to check the expiration dates and check to make sure that everything you're carrying is legal in the country that you are entering. You may be okay with using it with a prescription, but make sure you have a letter from your doctor that says that you need this medicine in order to live or in order to maintain your health. This is sort of our leftovers box. So it has our burn items. It has our dental emergency kit, which is not something that I originally had in my head, but I'm glad that after having a dental emergency, we have it. We have our cool seasickness glasses. We've got our alligator clips, which we used to use to get beads out of kids' noses or things out of kids' ears, but I'm telling you, the number of things you need a long thing to get something is pretty long on a boat. But yes, so this is our sort of leftover burn kits. We've got aloe vera. We also have all of our testing kits in here. For now, it's just COVID testing, but if we go to countries that need other testing kits, that's something that we're going to use. And last but not least, we have something that I do want to show you that I think is really, really cool, are our emergency thermal blankets. So we've got them nice and small, and we could even throw these in a to-go bag separately so that we always have something that we can use if we need a thermal blanket, which you never know when you need it. That is our medical kit. Like I said, it's not huge, but it is modular, it is labeled, it is up to date, and most importantly, Dave and I both know how to use everything in that kit. I hope you enjoyed this episode. We have 11 more episodes coming up where we're going to hopefully teach you a lot of first aid and how to use a lot of things that are in here. You were going to get CPR training modules and a lot of other things that I feel are important for sailors to know while they're on their boat and they're trying to stay healthy and safe while they cruise. Well, I hope you enjoyed that. And I hope it helps you start to think about what your first aid kit will look like. If you already have one, I hope this gives you an idea to go back and take a look at it and say, is this my medical kit? Is this, the kit that is perfect for me, my crew, my boat, my environment, and my cruising plans for the next 6 months? And I hope that the next few episodes through the rest of this year are going to help you build your medical knowledge when it comes to sailing safely and keeping your crew safe, and maybe sometimes even saving their life. So stay tuned. We've got a lot of really exciting episodes coming up every Monday. No, not every Monday. Every month. We're hoping to do it the first Monday of the month, but we'll see. It's going to be on a Monday, I promise. And we'll see you next month.